L'héminégligence est un déficit neurologique.
Hemispatial neglect is a neurological deficit which affects the perception of sensory information coming from one side of space, but also the execution of actions in this part of the space which is located on the opposite side to the cerebral lesion affecting the
La
patient.
lésion cérébrale dont est porteur le malade.
Clinical tests based on copying drawings, for example, reveal hemispatial neglect. If you ask patients to cross out each line on this page, they do it from right to left and omit to cancel lines on the left. In dictation, patients only use the side of the page opposite from the neglect. Patients act in the same way to position the figures on a clock dial or when drawing a flower from memory. For these patients, a new prospect for rehabilitation is available today, although there are some precautions to take. You have to make the right diagnosis, then precisely assess disorder severity, and then adopt the best conditions for rehabilitation. Various techniques exist. The oldest is the idea that you should try to attract patients' attention to the side of the space they are neglecting. Other more recent techniques developed are based on action, starting with visuomotor adaptation tests. Prismatic adaptation is one such technique.
On sait que les patients qui présentent une héminégligence ont en quelque sorte.
We know that patients presenting with hemispatial neglect have to some extent a shift of their representation to the right, at least in the case of left hemisphere neglect. This is what you can do with prismatic lenses. You shift visual perception in one direction, in fact towards the right. What we wondered was, could the patient, by fighting the glasses, also fight the disease? You could make a quick analogy between what this disease does, a rightward shift, and prismatic deviation itself. The principle is very simple. The lenses do not have the same thickness throughout their surface. The optical rays are bent. When you put on these glasses, the whole field of vision is shifted evenly. So, in practice, if I want to touch a glass or a pen on a table, I will see my hand arriving away from the object which I want to pick up. By executing several movements, by repeating these actions directed towards a simple goal in space, the brain gradually perceives, consciously or not, that an error exists. Making several movements enables the brain to realize that this error is always in the same direction, and the brain then compensates for this error, since it is systematic, and organizes solutions so that movements are now skewed in the other direction. In normal subjects, something well known for over 100 years, the effects disappear almost as soon as the glasses are removed, and the adaptation regresses immediately. On the other hand, in subjects suffering from neglect, and it is this phenomenon which is interesting in rehabilitation, the effects last much longer and even increase after the glasses are removed. So it is a simple method, easy to execute in a hospital service and possibly even in local practices. However, rigorous conditions are crucial to the therapeutic outcome.
Vous allez vous installer sur cette chaise le plus au fond possible.
Sit in this chair as far back as you
Et
can.
vous allez vous rapprocher pour
Now
avoir
move
le ventre
forward
qui
until
touche
your
la
tummy
table.
touches the table.
Très bien. Je vais centrer la planche en face de
I will
vous.
center the board opposite you.
Et vous allez poser votre menton
Put your chin
sur la
down on the
tablette.
rest.
Vous installez bien à bonne hauteur.
Are you
Vous êtes bien
comfortable?
installé?
Oui, docteur.
Vous allez poser votre main droite sur la planche.
Put your right hand on the board on the upright of the rest, like this. That's the starting
Et
position.
vous allez pointer votre index.
Extend your forefinger. You should not be able to see your hand in the starting position.
Le patient doit simplement se positionner.
Patients just position the hand on the rest and then make 50 to 100 movements towards points in front of them. All they have to do is move their hand at a reasonable speed towards the points, generating errors so that the brain can compensate and, by compensating for these errors, simultaneously fight the distortion from the glasses and their disease.
Toujours en position de départ.
Still in the
Mouvement,
starting
vous allez faire le
position,
plus
now
rapidement
point
possible.
as fast
À
as you
droite.
can.
Très bien.
That's
Position
fine.
de départ.
Start position
À
to the
gauche.
left.
Bien.
Like
vers le
this.
menton. Comme ceci. Très bien. À droite.
To the right.
Très bien. Au départ. À droite. Très bien. Nous allons faire les mêmes
Okay,
exercices
now we'll
avec
do the
les
same
lunettes.
exercises wearing the glasses.
Ils sont bien
Do they fit
ajustés.
right?
Oui, docteur.
Alors, nous
Now
allons
we'll
cibler
target
à
the
droite.
right. You point.
Vous pointez. Très bien.
Come back to the
Revenez
start
bien au
point.
départ.
Don't look at your
Là, vous
hand when
voyez
you
votre
start the
main au
movement.
départ du geste.
Move
À
left
gauche,
very
très
quickly.
vite.
Come back to the
Revenez au
start
départ.
point. Go
À droite.
right.
Très bien. À droite. Très bien. À gauche. Allez, encore plus
Go
vite.
faster.
Très bien. Au départ. À gauche.
While you're wearing the glasses, the brain compensates for the prismatic distortion glasses.
Très bien.
To some extent, it generates errors in the opposite direction from the glasses.
Très bien. Allez,
Adding
plus vite.
both
À gauche.
errors together creates a movement as precise as in normal conditions.
Très bien. Allez, plus vite à droite.
Additionally,
Très bien,
the
à
brain
droite,
has
plus vite.
totally
Très bien, à gauche.
compensated for the errors induced by the prisms, and then, if we continue the therapy, the brain will develop an in-depth adaptation. When you remove the glasses, this adaptation can be observed as errors appearing in the direction opposite the prismatic deviation.
Très bien. À gauche. Très bien. Vous allez fermer les yeux.
Close your
Je vous
eyes.
enlève les
I'm
lunettes.
taking off the glasses.
Ouvrez les yeux.
Open your eyes.
Vous
Look at the
regardez la
right-hand
cible de
side
droite.
target. Close your
Fermez
eyes
les
and
yeux et
point
vous
to
venez
it.
pointer. Très bien. Ouvrez les yeux.
Open
vous
your
regardez la
eyes.
cible de
Look at
gauche.
the left target.
Fermez les yeux
Close your
et vous
eyes
pointez.
and point.
Revenez au départ.
Come back to the start point.
Ouvrez les yeux. Regardez
Open
la
your
cible de
eyes.
droite.
Look at the right
Fermez
target.
les yeux. Vous venez pointer.
Close your
vous revenez au
eyes
départ.
and point.
Très bien. Ouvrez les yeux.
Open
Regardez
your
la cible
eyes.
de gauche.
Look at the left target.
Fermez
Close
les
your
yeux
eyes and
et vous
point.
pointez. Très bien.
Very good.
Ouvrez les yeux. La séance de rééducation
Open
est
your
terminée.
eyes. We've finished now. If the technique is used correctly, improvement is seen immediately when the patient removes the prisms. You can often observe an amplification of the effect after 1 hour, then after 24 hours, and in some cases after several days.
À l'heure actuelle, on se rend compte que certains patients
We have also seen beneficial effects lasting over a month in patients after a single rehabilitation session.
qui dépassent la durée d'un mois. Certains autres peuvent redevenir
Others
négligents
demonstrate
en quelques
neglect
jours.
again
Ce
in
qui
a
veut
few
dire que
days.
on est obligé d'ajuster
This
le
means the
traitement
treatment
en
must be
fonction du
adjusted
patient,
to
en
each
fonction de la
patient
façon
and the
dont
way
le
they
patient
respond.
réagit à ce traitement.
Ces résultats peuvent être évalués.
These results can be assessed by the behavior of the patient and neuropsychological tests measuring the percentage of improvement.
Le pourcentage d'amélioration. On peut
You can repeat this rehabilitation technique, for example, several times a month, but it's not necessary every day.
proposer cette rééducation tous les jours.
To summarize, to get the most out of the prismatic adaptation rehabilitation technique, it is essential to respect some key points. Correctly align the patient with the apparatus, with the head at the right height and the chin on the support. Take care to position the hand correctly. It must systematically return to the starting point outside the field of vision. Check prism cleanliness and parallelism and ensure that the prisms fit well. Encourage the patient to point quickly. Respect the rehabilitation method protocol and systematically check that adaptation has effectively occurred. In this way, you will have optimized the conditions needed to obtain an important and durable effect on your patients suffering from hemispatial neglect.